Yes, doctor. Any indication for doing 0 degrees of retroversion to plan to this is now 0 degrees for an anti-version? I'm thinking in the glenoid. If you have one version of the glenoid, do you plan to do anything?
Never change the humerus, even if there is a huge retroversion of the glenoid. Solve the problem of the glenoid in the glenoid. Don't try to attempt to compensate for the erosion of the glenoid with the humeral erosion.
So the message is that we have to take care about how much amount of bone we have, because sometimes the head is not round, it's formed. So we have to put it in the version that have more bone.
If you have the choice, it's better to be 0 degrees retroversion. Because trying to follow me, if you have 0 degrees retroversion like this, the range of motion in internal rotation before impingement against the glenoid is huge. Now if you implant with 30 degrees retroversion like this, the range in internal rotation is less. So if you have to choose, I prefer 0. So if you have a large humeral head, which is oftentimes the case, it is better to reach to be close to 0 degrees. But it has been said that it could be the cause for instability, not at all. If you stay in the range of 0 to 30 degrees. Any other question regarding the humerus? Height is crucial. So for the more difficult cases, we'll show you tomorrow. It's easy. You just get each raise the day before, and you compare, you measure the length of the other humerus, and you just reproduce the correct height. That is post-traumatic arthritis revision arthritis. For cuff tear arthropathy, there is no problem. You have a very good number. Okay, now let's speak about the glenoid. Glenoid is not easier because you have to expose correctly the glenoid, but you do not have the problem for instability. The key point for the glenoid is to implant it as low as possible to avoid mechanical impingement and notching, so as low as possible, and never put superior tilt. Always put inferior tilt. What is superior and inferior tilt? Here is a normal scapula. Superior tilt is when the glenoid looks upward. Inferior tilt is when the glenoid looks downward. Why is it so important? It's very easy to understand. Look. Here, imagine that I implant the let's come here so it will be easier for me. You implant your glenoid with a superior tilt. It will be like this. Then, in the any direction position, meaning arm at rest like this, what happens is you get impingement between the humerus and the glenoid here. Now imagine that for the same position, arm in the resting position, you put inferior tilt. You implant your glenoid like this. So for exactly the same position of the arm, you do not have impingement anymore. It's so simple to understand. Superior tilt, you get immediately problem of loosening of the glenoid, like Maurizio showed us. If you implant your glenoid with this position, you have no contact, no impingement anymore. So, good position, lower part of the glenoid, inferior tilt. So how do we deal with that? Here, you have a guide. You have a guide for the glenoid. And this is exactly the diameter of the base plate of your glenoid. The base plate is this piece. It is 29mm diameter. And that is exactly the same size. So with this guide, what you try is to exactly implant it flush with the inferior part of the glenoid. And if you do this, you will never be too high. So then you want to have a little bit of inferior tilt. And for that, you have two different holes in the guide, 0 degree and 10 degrees inclination. This one is for the other shoulder. So you have the possibility to implant the guide pin in the correct position with regard to the inferior part of the glenoid and with the inferior tilt. That is the inferior tilt, and that is where you want to implant your base plate. And you just put the guide pin in, and it's done. Once you have done that, you know exactly where you have to implant your glenoid. Then everything is cannulated, and you just follow this guide pin. So the guide pin is implanted lower and half, flush with the inferior part of the glenoid, 10 degrees of inferior tilt. Then you have a rimmer, 29mm diameter. So it's easier to read the glenoid with that than with the anatomic prosthesis. Because with the anatomic prosthesis, you have to respect the height of the glenoid, which is always bigger than the width of the glenoid. This is flat back, and it is very easy to implant. So you start to read, don't push and power. Just start to power first and go slowly in order to avoid fracture of the glenoid. The typical error of the fellows that they push and then they start to read and bam, fracture of the glenoid. So be careful, it is a risk, and slowly start to power and go slowly, slowly, slowly. In order so it's so good, so you make that. Until when we do that? Well, usually you need to have what Greg Nicholson called the subchondral smile. Because of the inferior tilt of your glenoid, you always have more, you read more inferiorly, of course. But this is normal, and you see always a smile, a subchondral smile inferiorly. But basically what you want is just to have a good anchorage. You don't want to remove too much. Now, you have three possibilities. First possibilities is to use a ranger inferiorly to remove the excess of bone. That is the first possibility, very easy. Then you can use also this kind of rimmer, which is very easy to use. It allows you to prepare the place for the sphere, because you don't want to have problems with the sphere. I show you exactly what I mean. Look, this is 29mm. Here it's possible you have better. This base plate is 29mm, but the sphere is 36mm. You are going to do this, and you do not want to have a problem with impaction. So that means that you need to prepare a circle around the base plate just for the sphere. And that is the reason why we need to use this rimmer to prepare a slot around the base plate in order to impact it correctly. That is easy. You can use superiorly. I guess you see that superiorly we have a nice slot, and you can turn it also to remove the inferior part slowly, slowly. So why is it just a quarter of a circle? Because posteriorly you have the posterior retractor. The posterior retractor, which retracts the humeral head, is here. And this is difficult for the rimmer. So by using this kind of, how do you call it, pie shape, is that you can do this without any problem. You have another possibility. It is a 36 rimmer, which is exactly for the same reason. The goal is the same. But if you want to use it to prepare the slot for the sphere, remember that you need at that time to remove the posterior retractor. Otherwise, you cannot turn it. But it's exactly the same. So it's what we did for many, many years. You need to remove the bone, you need to remove the posterior retractor. And now you can tell that everything is good everywhere. You are not centered. No? Yes, okay. Just maybe come here. Come closer. You will see much better. So now you see a perfect preparation, meaning that you have a good ball. It is inferior. You do not have, you have the slot for the sphere. And now you just need to prepare the somehow hole of the peg. So the peg is this piece. And I tell you, this is the most important part for the blade anchorage. If this peg is very well anchored, you don't need the screw, basically. So it is a very strong one. The diameter is 7.9 millimeter, meaning 8 millimeter. So we have a special drill, which is, this is a 7.5. Yes, 7.5 in order to have some